All right, so for our injury prevention program that we chose, we decided to do the Sanford knee injury prevention. So just to start off for our PICO question, we wanted to know, is the skip more effective at preventing knee injuries in collegiate athletes when compared to FIFA 11 and all the other knee injury prevention programs that are out there? So just to start off, what is SKIP, also known as the Sanford Knee Injury Prevention Program? It was designed to help reduce risk of knee injuries in general, but they specifically wanted to focus on also non-contact ACL tears. The program itself is also created to improve overall athletic performance. And the reason it does increase athletic performance as well as reducing risk of knee injuries is because of the multifaceted approach that it takes. It focuses on proprioceptive and neuromuscular exercises, much like all the other knee injury prevention programs that are out there. So the recommendations for this program is that you start with younger athletes, so implementing it in middle school athletes as well as high school, collegiate, and professional. And it should always be incorporated into pre-activity routines, so before a strength and conditioning session, or even just a practice before games, however you want to implement it. It usually takes about 15 to 20 minutes once they become familiar with the program. So introducing it for the first few times, it will take a little bit longer, but as soon as they learn and like they know the steps to go through, it's as simple as 15 minutes before an activity. And for maximum results, it should be done 8 to 12 weeks at a time for 2 to 3 times per week.
Might skip the slide to that. Yeah, there we go.
So the first part of the SKIP program is the dynamic warm-up. So the purpose of the warm-up is to prepare the athletes for the activity they're about to perform. And the current research suggests dynamic warm-up activities can decrease risk of injury and may be more beneficial than static stretching that most old school coaches will have people do. So here are the exercises that are listed by the SKIP program. As you can see, there's multiple different dynamic stretches along with a couple of kind of activation exercises. Going even more into activation, activating the glutes and core musculature to promote proper techniques and decrease the likelihood of using compensatory movements during strengthening and plyometric and agility exercises. So this is kind of getting the athletes ready for the next steps of the SKIP program. And then this is a little bit more guided in the exercises. So they want these 4 exercises done for these repetitions and for these times that are listed as well. And then here are pictures of how they want all the different exercises done, and then how they also want them held.
All right, now we're going into the strengthening portion of the Sanford. So the strengthening portion is used to strengthen the hip and knee stabilizers. The resistance band in the first 2 exercises is important because it really helps to engage the glutes. And one of the main parts of the Sanford is to work on the glutes because they feel that that is such a strong muscle group to prevent ACL tears. So going into the exercises, the body weight squats with the band and the lateral band walks are the most important for the placement of the band. So you want just slightly above the knee to provide the most resistance, but not the most resistance. And then other exercises are walking lunges. So you're going to do them forward, backwards, and then to the side. So as you can see in the pictures, the band above the knee on both the lateral band walks and the body weight squats.
Might go back again.
Yeah.
There we go.
Yeah. And then another portion is the plyometrics. So following exercises should be performed explosive to help improve strength, power, and speed during athletic activity. Focus on proper jump and soft landing techniques. So these exercises include lateral squat jumps over line, forward backward squats over line, squat jumps at 90-degree turns, lunge jumps, 2-to-1 hop, and single leg side to side hops. So as you can see in the pictures, the main focus is landing and takeoff. So as you see in most of these pictures, their body is straight up and down, and their knees are bent when they're landing to give that nice soft landing. And then the final portion of the Stanford is the agilities. These movements help encourage and reinforce proper technique and neuromuscular control during sport-specific movements. Pay close attention to the technique when first performing these, and then working on becoming faster. So these exercises include forward run with a 3-step deceleration, a 3-step shuffle, and a zigzag cutting. So as you can see in these exercises, there's a lot of focus on the knees and where the body weight is. So for the running with deceleration, you want knees right over ankles. You don't want the knees too much forward or too far back. And then with the side step, you want your body weight almost in the middle. You don't want leaning to a side, which will cause your knee to go into a valgus. And then finally for the zigzag cutting, proper alignment and no varus force for the knee, like having your knee go too far out and keeping your body straight in line.
Man, there we go. All right, so now time for everybody's favorite part, the research behind the Sanford. So let's get into it. So this is the effectiveness of knee injury and anterior cruciate ligament tear prevention programs. It was a meta-analysis, and for all the research slides, I basically just focused on the conclusions and findings. For this particular meta-analysis, the conclusion or findings were that it provides evidence that neuromuscular and proprioceptive training reduces knee injury in general and ACL injury in particular, which I'm sure is no surprise to anybody. A modified neuromuscular electrical stimulation protocol for quadriceps strength training following ACL reconstruction. The modified NMES quadriceps training protocol can be useful adjunct to ACLR rehabilitation programs, but the treatment effect is smaller than what has been reported in previous studies. And finally, the influence of abnormal hip mechanics on knee injury, a biomechanical perspective. Based on the evidence presented as part of this clinical commentary, it can be argued that interventions which address proximal impairments may be beneficial for patients who present with various knee conditions. And included in our presentation, there is a video. It's about 12 minutes long. It's through the Sanford website. So I'm not going to play it on here just for time's sake, but it is available. And I'll leave that link in our video description, just so you guys can know where we're getting this from. And then I believe it's going to start playing now. We're just going to skip that. There we go. So why use SCIP? Unlike other knee injury prevention programs, SCIP incorporates gluteal activation to further prevent knee valgus, which in turn more accurately prevents ACL tears. And those are our references. That's the whole thing.